Hello, everyone. My study looked at the relationships of gastrointestinal dysfunction during enteral nutrition delivery in ICU patients as a post-hoc analysis of the target trial. Gut dysfunction, usually presenting as vomiting, regurgitation, diarrhea, constipation, is commonly seen in critically unwell patients admitted to ICUs. It can limit our ability to deliver enteral nutrition successfully. Delayed gastric emptying is of particular concern, mainly because it's known to be associated with adverse outcomes. To detect this, the feeding tube, which is placed in the stomach, is regularly aspirated and the volumes measured. These gastric residual volumes are considered a rough measure of the gastric emptying rate. The target, or augmented versus routine approach to giving energy trial, was a large double-blind trial that recruited almost 4,000 ICU patients across Australia and New Zealand to receive either a 1.5 kilocal or energy-dense feed versus a standard or 1 kilocal per ml feed, and it was found that there was no difference in survival between the two groups. However, the energy-dense group had larger gastric residual volumes. The aim of this post-hoc analysis was to explore the relationships between gastrointestinal dysfunction and outcomes in critically unwell adults. We defined pre-hoc that a gastric residual volume greater than or equal to 250 mL as large. We compared incidence, timing, duration of delayed gastric emptying, its management, and impact on clinical outcomes. Statistical analysis was conducted using SPSS version 26 and using chi-square-TESS. Moving on to the results. Of the 3,876 patients, of whom 1,777 patients had a GRV greater than or equal to 250 mL, at least once during the study period up to 28 days were analyzed. While baseline demographics was similar, our findings showed that in critical illness, males had a slightly higher incidence of large GRVs when compared to women preponderance noted in health. There was also minimal difference in illness severity, baseline illness severity scores, as well as baseline lactates, but these were not clinically significant. Large GRVs occurred more frequently and lasted longer with energy-dense nutrition when compared to routine nutrition. Patients with large GRVs also received more treatment like use of prokinetics, use of post-pyloric tubes or intestinal feeding, and parenteral nutrition. After adjusting for baseline illness severity, large GRVs were associated with worse clinical outcomes as we note in this table. In conclusion, the risk factors for delayed gastric emptying in critical illness appear to differ substantially from those in health. A GRV greater than 250 mL is associated with increased need for management strategies and several negative sequelae, including increased length of stay in ICU as well as in the hospital and increased mortality. A causal relationship thus cannot be discounted. Avoiding reversible factors like the use of energy-dense enteral formula may assist, but requires further investigation. Thank you.